Hi there. My name is Michael Kramer, and I'm going to be one of the faculty contributing to the 2020 Summer Maternal and Child Health Training course, and I'm really looking forward to meeting all of you all. So I wanted to spend a minute or so giving a very quick introduction to me and how I came to be a maternal and child health epidemiologist. So many years ago, I finished my undergraduate degree in social sciences, and I had a sort of vague idea that I was interested in working to extend healthcare access to underserved communities, and that was in part because I had grown up in southern Appalachia and I was interested in care in rural areas. I started on a path towards getting a Master's of Public Health and Policy because I thought that was important, but a friend of mine said, oh, if you're going to do healthcare access in rural areas, maybe you should think about being a clinician, and maybe you should think about being a physician assistant in particular. So I changed courses and I became a PA, still interested in delivering healthcare to underserved communities. But I didn't actually end up being in Appalachia. I ended up staying in Atlanta, where I was working at Grady Hospital, which is one of the safety net hospitals here in Atlanta, specifically working with HIV/AIDS patients, until I had this really great opportunity to go work on the Navajo Nation in southwest U.S. And I lived in this rural frontier setting for about 4 or 5 years, providing care at a tribal hospital. It was an amazing experience and a wonderful place to work, but at some point in that I began to burn out because I really realized what I was still passionate about was population health issues, and what I was doing as a clinician was very focused on delivery of individual solutions. I was also really interested in teaching, and so I had this change of path and went back to school and got my PhD in epidemiology with a plan to return back to the Southwest and focus on training the public health workforce. But I had a family and they had different plans, and so that changed. I ended up staying here in Atlanta. So I currently do applied maternal and child health, social epidemiology, and then also spatial methods, GIS and spatial methods that help me work on both of those two things, applied MCH and social epidemiology. I'm really interested in how place matters, how individual and population health are driven by spatially located social processes. I've been doing research and teaching here at Emory for about 10 years, and I'm quite happy here, although this nonlinear path may continue to lead in other directions. For example, I raise dairy goats, and who knows, maybe my next career will be as a goat herd. So that's a little bit about me, and I look forward to meeting you all. Thanks.